Although infants very rarely encounter a shockable heart rhythm, the use of an AED can still be life-saving if needed. High-quality CPR remains the foundation, but if an AED is available, it should be used without delay. The key steps of this are, when you know the infant is not breathing, call 999. Ask a bystander to get an AED if available. Begin CPR immediately. Do not delay CPR for the AED. You must begin compressions and rescue breaths. When the AED arrives, switch it on while continuing CPR. Always keep compressions and breaths going while the AED is being prepared and applied. Do not stop CPR for any longer than needed. If the AED has pediatric pads, use them. If not available, adult pads may still be used. Do not delay waiting for pediatric pads. One pad is placed on the front of the chest, slightly to the infant's left side, and one on the back between the shoulder blades to ensure the heart is between the pads. Follow the AED's voice prompts. Allow the device to analyze the rhythm. Make sure no one is touching the infant when the AED is analyzing or when delivering a shock. Once the shock is delivered, if it's required, resume CPR immediately for 2 minutes before the AED reanalyzes. Continue until the emergency services arrive or the infant shows signs of life. Remember, when an infant suffers a cardiac arrest, every second counts. Start CPR quickly, apply the AED without hesitation, and follow the prompts. With prompt action, you have the best chance of making a difference. And finally, it's worth noting that infant use with AEDs has been added in the 2025 UK Resus Council guideline changes, and also the pad position has slightly moved. So if you're using an AED on an infant, you may see that the pictures on the AED pads show the pad in the center part of the chest. You do need to move it over slightly to the left-hand side. Also, there may be no reference to use on infants, but rest assured it is okay to use these on infants.